And we'd like to thank One Time Plumber for their sponsorship of our Community Spotlight program here on KRIM. Good morning, Rim Country. Chris Higgins in the studio here at the Sawmill Theater Complex. Hope you're having a beautiful Wednesday morning. It is a gorgeous day out there. Just a reminder, it is senior day, senior night for our Payson High School beach volleyball team. So if you're able to make it out there to Granite Dells Park, it's senior night. You can go cheer the ladies on for that. Well, this morning we have the CEO of Banner Payson Medical Center, Hoyt Skabelund, in the studio. Good morning, Hoyt.
Good morning, Chris.
And we're going to be talking about Banner Payson Medical Center, some of the new services, new doctors, staff, just things that are happening at Banner Payson Medical Center. There's always something happening.
It's you know, I was thinking yesterday, we're back in terms of all of us being so busy after the pandemic. I remember during that pandemic era, it was a different type of work, and it's slower pace in some ways, higher pace in others. Boy, we're back to normal now, where it just feels like you can't keep up with a lot of good things going on. And of course, there's always challenges, but we're beginning to hit our stride in some areas, and we're not perfect. You all know that, and we're trying to get better every day.
Well, I think something that you mentioned before the program that I think I would just like to touch on, talk about, is how fortunate we are to have a hospital in our community, because you shared with me before the program the number of hospitals that have been shutting down across the U.S. And that's just a reality. It's not to try and scare anyone or say, ooh, you know, this could happen. Well, it can happen, but again, we should just be very fortunate. So I think I say that to help people maybe have more grace, more understanding when there's something that Banner can't do or can't provide. Just let's be thankful that we have Banner Payson Medical Center and all the services that are offered, because it's not like that in every rural community.
Thank you. It's a sobering circumstance. Prior to, I don't know, 10 years ago, maybe it's 7 years ago, you just never heard of hospitals closing. The hospital in Tonopah, Nevada closed, and that was rare. It was like nationally on the healthcare syndicates, and that was like, I don't know, 10, 15 years ago when that happened. Well, since then, it's become since the pandemic, frankly, that put a strain on hospitals. People think, hospitals made a ton of money during the pandemic because there was so much volume. The challenge was there was so much expense in the volume, because you didn't have enough staff, and staff were scared, and people were sick, and so it became very expensive to run a hospital, and most hospitals didn't do well during the pandemic, and we began closing hospitals. So about 100 hospitals closed prior to this year over the last 5 years, which is unbelievable. I don't know the numbers anymore. There were about 4,200 hospitals in the country, and so that probably, you'd have to go online and Google it. I didn't Google it. It might be close to 4,100. Now there's inpatient rehab hospitals, there's different mental health hospitals, so there's many different varieties, but most are what we call acute care hospitals, like we are. And so now in 2025, their hospitals are closing at a much higher rate. So there was a week earlier this year where 5 hospitals closed in 1 week. It's crazy. So you have bankruptcies being filed, which is different than closure, and then you have closing. And so it's a challenging time in most of these. So right now there's about 700, I think it was Becker's that reported there's about 780 hospitals across the nation that are on the verge of closure.
Oh my
goodness. And and earlier this year, 6 weeks ago, that list was 440. Now it's climbed to 780, and there's a lot of contributing factors to that, and they're most all rural. So back to your point, I'm glad that our hospital is financially stable. I'm glad to be part of Banner Health, which contributes to that. And then to be located where we are, a place where we have stability, and the Payson economy is relatively stable, not a lot of unknowns, and it's the beauty of living in paradise is it's a little easier to recruit, in my opinion, having been in deserts in Wyoming and in Nebraska and harder locations to recruit for sure.
And I know something that's consistent, boy, the the doctors, nurses, the staff that you are able to bring into Banner Payson Medical Center, when we interview, when they come on the radio, they love it here. They love it here, they love the hospital, they love the team they're working with, their coworkers. They just rave about the experience and really want to be here. And I know you always talk about how that's intentional. You're looking for people that want to be here,
Right.
and you share with them the pros and cons
Amen.
of being in a rural area, because I think that's really what it comes down to, whether it's the hospital or any industry here. It's the perception or the what they expect, the expectations.
Are we a fit for them? Are
Yes.
they a fit for us?
Yeah.
And that is it makes it, what I love about Payson, besides the weather and the wildlife and the setting, the convenience to the valley, is we although after the pandemic something happened. I don't know that we used the pandemic as the milestone marker. I don't know if it was a direct result of what we went through or we just changed as a people, but in healthcare now we read about violence in hospitals and with healthcare workers, but
yeah.
we didn't have that 10 years ago, 7 years ago. It's become very common. Well, in Payson we don't have much of that. We do have patients who will become just rude in the lobby with the volunteers. So rare, but it happens, even in Payson. But I would say we're on a little bit of an oasis in terms of we have a great community with respectful people towards healthcare professionals, and that also contributes. When the doctors have a relationship with their patients that's genuine, both ways, from the doctor to the patient and the patient to the doctor, I think we're becoming more and more unique in our setting, because the rest of the world, especially in metropolitan areas, we're just melting down in terms of kindness and respect. And I know there's political unkindness and disrespect in the community in Payson that's a weakness for us. But when we get to the hospital, the people don't bring that to the door, which I really appreciate, and that helps us recruit. So one thing, Chris, on that note, that I'm excited to share that you and I didn't get the chance to talk about is when I came to Payson in November 9th, 2020, in the dark of the pandemic, right before one of our big 3-foot snowstorms, which was pretty amazing. I didn't realize we had those before I moved here, and that was shut down.
Yeah.
Waste management system couldn't move trash for 2 weeks. It was an interesting experience. But November 9th, 2020, when we came there, in our Banner Medical Group primary care clinic, it could be 4 months before we had an opening for a new patient. And that was and there was a shortage of primary care across Payson. 4 years later, I'm pleased to say that many groups have, provider groups have grown and added providers. IMS, Ponderosa Family Care, North Country Healthcare has Jake Ramsey and Jonathan Tinsel, and the other practices in town. And Banner Medical Group, we've hired Dr. Matern, Dr. Crandall, Dr. Galvin, and then we've added Rachel Altman, nurse practitioner, Emily Orr, and we also we launched our family medicine residency program last year, bringing Dr. Johnson and Dr. Joe, and now we just matched with our new residents that will begin here in June. And our new residents is Dr. Renner, R-E-N-N-E-R, and Dr. Dupree. And they'll become our first year family medicine residents. They do a 3-year training on top of being a physician. And then Dr. Johnson, Dr. Joe become second year. And eventually we'll have two third year, 2 second, 2 first, so you have a total of 6. Well, those combined residents actually see patients and they create capacity. So we now have double the providers that we had in our clinic, and there's others in town that in other practices. And now you can get an appointment to establish as a new patient within a week. And then depending on if you're the 4th caller or the 5th caller, it might be 2 weeks, but massive improvement in that area, and I'm proud of that. On top of that, then we're launching our internal medicine residency program. It'll be housed here in Payson. It's under the Banner Medical Center internal medicine residency program. And our first two residents that we matched with is Dr. Anthony, and she'll be joined by Dr. McIntyre. So we will have, and then we'll have, a year from now, we'll have 2 more, and then 2 years from now, we'll have 2 more. So we'll have a total of 6 physicians being trained in, 12 physicians. 6 will be trained in family medicine, and 6 will be trained in internal medicine. Super, super unusual in a rural setting. And this is a real tribute to the MHA Foundation and their work over the last decade, and even before that, in trying to enhance rural healthcare training in Payson, with the intention of being able to fill vacant positions so we can serve the healthcare needs of Rim Country better. And I'm proud to tell you, during my tenure, I get to be the lucky one picking some of the fruit of that labor. But we're glad to be part of University of Arizona, Banner University, Banner Desert Medical Center, and Banner Payson Medical Center, all together with the MHA Foundation, the Center for Excellence in Rural Education. All of that's leading to us to have even more physician capacity in the next 3 years will be joining us. On the heels of this, a negative thing. The projection is that there will be a shortage of primary care physicians, topping 120,000 over the next 10 years. So rural settings are going to feel the pinch the most, and we're at a point where we're crescendoing. We're not even crescendoed yet. We're going to reach a high point in a couple more years where we will be bringing 12 physicians that are doing their residency training, and that will benefit Rim Country. So I'm excited about that.
I was thinking about that when you were talking about the closures of hospitals around the country, mainly in rural areas, and you said that there are many factors, and I thought one has to be just a limited amount of medical professionals, whether doctors, nurses, everyone in the medical field. It seems like the positions are in high demand, so to attract them to your hospital, I mean, salary is a big part of it, where they want to live. So there are those that want to live in the rural community, smaller community, but then
Smaller
also,
percentage of the candidates want to go rural, so you're already challenged there.
Yep, where the majority want to be in the metropolitan area.
Yes.
So that is definitely a challenge.
It is a challenge, and one of the places that we're seeing that challenge most significantly impact care in rural settings is obstetrics. So there's a phrase coined in the last decade, even in the last 15 years it's been a challenge, is an OB obstetrics, OB desert. So this is where in rural settings where there is not a hospital that delivers babies, which is usually driven by not having physicians that deliver babies, or not having obstetrical nurses and being able to recruit and retain. So across states like Wyoming and some of the frontier states that are large and rural, that there's beginning to be, if you go on OB Desert and do Google, you can start to see colors and shades that show where there isn't obstetric services. So now you're driving 3 hours to deliver a baby. For us it would be 90 minutes, but if you're in Young or in Heber, you start getting into more. So Banner offers obstetrical services in every rural that we offer. That becomes challenging. We're blessed to have Dr. Murphy, OBGYN here, loves Payson, does a great job clinically with patient safety, and coupled with Dr. Roberta Matern, who is our family medicine residency director, but she also delivers babies. Dr. Spires will be joining us in October, and she was a medical student, a third-year medical student, who rotated and spent a year in Payson. Went then to Greeley, Colorado, where I used to be the CEO of a hospital, a large hospital up there, and where we had a family medicine residency training program where OB is taught. So she's completing that residency. She will be able to deliver babies, and she'll come in October. So we're growing our capacity when other rural hospitals are closing their ability to deliver babies.
Wow, that's That's a good thing.
It is a good thing.
That's
We're having a
really
lot of
good.
opposites where others are going over a waterfall cliff. We're climbing up the
Wow.
mountain, making higher ground, which is a real blessing. Some of that is not because we're better than them, it's better circumstances.
Mm-hmm.
So we're really fortunate in that. And I think having Banner Health being part, that Banner we're not-for-profit and we're committed to doing what's best for patients in the areas that we
Mm-hmm.
serve. And you never know what the next 10 years brings and what constraints will come. But right now, the services we're offering, we are stable
Mm-hmm.
in these services and we're looking to grow where we can.
Mm-hmm.
And then we're looking for gaps where could we offer this service in a high quality, equal manner, and is it financially sustainable?
Mm-hmm.
And so we're always looking to grow. So one of those is oncology, where we're looking to grow.
I think also, and you can say whether this is true or not, but all of the great partnerships that Banner Payson Medical Center has established in Payson and Rim Country has to help with the success of
Helps.
Banner Payson. There's strong, obviously a strong relationship with the MHA Foundation,
Absolutely.
but Gila Community College, and
Absolutely.
now with the nursing program
Oh.
getting back.
Wonderful.
It sounds, I think they're still waiting, right?
Sure.
They're still waiting.
There's no official announcement, but it is, I think Christmas is coming. And
Wow.
I think it's a miracle and a tribute to the hard work of
Mhm.
all involved, from the board to the faculty,
Mhm.
to tremendous personal sacrifice of time and effort. And
Mhm.
it's the best outcome we could have ever hoped for. And when we were looking at one point, it looked dismal.
Mhm.
And they have committed their lives to everything they can do to reestablish the college quickly, especially with nursing, and we're excited about that.
Mhm.
Fortunately for us, our retention has been at an all-time high in the
Mhm.
last 18 months. Our employee turnover has been below 12%, which I've never seen sustained before. That's huge.
Mhm.
And I think we're retaining the best, and so that helps even more,
Mhm.
because people love to work with the best.
Mhm.
And then you're attracted to the best. And so that's been helpful, because we're not going to have a graduate for a couple of years from the nursing program.
Mhm.
But we're having low turnover, employee turnover, and we're going to have a little bit of a drought here of graduates. We're hiring, I think we're hiring 7 of the new grads in the last several graduating classes.
Mhm.
And hopefully then we can make it 2 years without any major gap.
Mhm.
But yeah, those partnerships, MHA Foundation, CIRI, Gila Community College, super grateful. And I would add every physician office, every provider office in town. All of the community providers send patients to the hospital for x-ray, for different services, physical therapy services, whatever those are. We're grateful to have great partnerships in this community. The schools, I
Yeah.
consider a partner. The town,
Mhm.
all of you, the county, we rub shoulders and we have interactions and connections with almost most businesses in some way.
Mhm. Well, one of those partnerships we were discussing yesterday on our Community Spotlight program with Heather Stage from MHA Foundation and Tiffany Clough, who works with you and with High Country Seniors, volunteer coordinator
Yes.
for Banner Payson Medical Center, and the upcoming Women's Wellness Forum on the 26th. And Banner Payson Medical Center, MHA Foundation, main sponsors, but along with other offices,
Yeah,
medical
absolutely.
offices in town, and it's just a wonderful event. Also, when you mentioned the schools, Banner Payson Medical Center on the court.
Oh, that's just so
So,
neat. We're honored to
yeah.
be able to help invest in our youth
Mhm.
in the Banner Court, Health Court. We're honored to be a sponsor of what I think is a super unique event to promote women's health and awareness of health. And
Mhm.
we're honored to be there. Looking forward to opening that event and being honoring some. I think is it year 25, 26? I think it's 25.
25, 25.
And we're
yeah.
honoring the founders,
Yes.
those ladies that had the tenacity to help it happen, and here we are, 25 years later, continuing it, and that's a neat event. I hope folks will avail themselves and attend and benefit.
They were talking about that yesterday, where it started 27 years ago, so I believe in '98, but there were 2 years with COVID that they did not have the event, so it's been
The
held 25 years.
25th event, but it's actually over 27 years.
Yeah, 27 years. 98 was the first year, and it was at St. Vincent de Paul, the church there.
Really?
Was where the first event, and yeah, and just talking about the history a little bit, but it's great that there are 4 of the 5 that are able to attend and just share a little bit the history, stories from the early years.
I love history. I think it's such I hope we all look back on history and use it to inspire us to recognize we're living future history. Do you know what I mean? We're making decisions, and I think sometimes we forget that we do hard things, and that will one day be thought of in a high way. And so I think that motivates me to want to do my best and our best. And so we're glad to honor those women and honor all women that are in attendance to try to promote health and wellness.
Yeah, they said they only had about 50 spots
left.
So anyone listening, if you didn't hear yesterday's program, and you're a woman that has been to a previous Women's Wellness Forum, or you've never been, you can sign up through MHA Foundation, their website, or by calling their office, or stopping by their office. They make it very easy, all the different ways you can get signed up. So today you were going to be bringing a guest, but
I have to reschedule.
We have to reschedule because he has patients.
He has a lot of patients, and we're thrilled by that. Dr. Thacker, Thakkar. Dr. Thacker is a medical oncologist, and he's now, he joined our team in March, and he's coming and seeing patients, medical oncology patients with Jody Strand. He's coming on Tuesdays and Wednesdays, and I've spoken of him before. We've been excited. We first met 2 years ago and been working on trying to make this happen, and he accepted our offer to join our team, and he founded essentially the oncology program as it's known today at Summit Healthcare in Sholo, and then after that he founded what Cobra Valley Medical Center's Cancer Center has come to be known as, and then went and did some work in research and in some areas, and has missed patient contact, and he's an expert in rural oncology. And we'll bring him on a program here as soon as we can get his schedule reserved. He was particularly intrigued by our partnership with Banner MD Anderson and Banner, and he said, I have never had the resources that we have here that are the potential. Wow. And so we're excited. So patients are loving him, and we've been having to use a telemedicine with Dr. Abarish, which it just isn't the same as being seated in front of the physician where you can shake hands. And so he's doing great, and we're looking forward to growing the program. Our volume has grown with Jody's work, and now growing week to week. We've surpassed the volume that we've had even with Dr. Casper when he was visiting, and he's a golden child. So we're in a new era. We're hoping to receive approval for $10 million to renovate and expand our cancer center, to restore radiation oncology treatments, to bring Banner MD Anderson medical oncologists up. But that's a heavy lift in a time when hospitals are closing on a volume that doesn't justify it. But with the MHA Foundation's support and advocacy is what I'd say. There's no financial. We've not made a financial request for support, but their advocacy is instrumental, and so we hope that in the next year that we might receive that approval, and then construction, etc. And I'll give you those updates. But it's a precarious time financially for healthcare, so it might be a big, hairy, audacious goal that's unachievable, but I'm not giving up.
There you go. And now there is construction that is going on at the hospital, and tell us a little bit about that.
So if you might drive by and see construction vehicles parked and bricks being laid in various locations. So between the church there, the Church of Jesus Christ of Latter-day Saints building, and the back of the hospital is where our cancer center is. And we have it's also where our power generators are located. One of them was located in the hospital, and no longer can you buy a generator that has the strength that'll fit in that space. So we can't practically replace it behind the wall of the hospital. So we're having to, we've had to remove the block wall that hides the second generator. We require 2 generators for different reasons. So we've had to put a temporary walkway for our patients, and you can see that the bricklayers are now, I think the generator's located, and now we're laying brick again and hoping to conclude that project over the next couple of months. Then at the end of East Main Street, the hospital was built before East Main was built, and East Main ended up coming up on our backyard. And so you get to see our loading dock and our named dumpsters. So we have built a block wall, a privacy wall, to create a more attractive look. We've re-roofed the hospital and tried to reduce the items on the roof, pipes and different things to try to improve the appearance from East Main. And now we've got much of our backyard hidden. We're installing a sliding gate for our delivery trucks. That's occurring in the next 2 weeks. We're pouring concrete. We're making 30-year to 50-year investments in that area. We'll be expanding our loading dock and creating an awning to create weather protection. We have been removing aged landscaping along between us and Payson Care Center along the backside. And here over the next several months you will see us cleaning up broken walls and bricks and remove, and then we will re-landscape. We will paint that old hospital and have it secured for the next 30 years in appearance. We may have to, of course, paint every 7 to 10, but we're really trying to tie the campus together, and then we have some internal improvements to make. Probably the thing that will be most noticeable is when we reseal and replace some portions. We're going to reseal all of our parking lots or replace sections, so it'll be blacktop. That'll clean up areas that looked aged, and then we'll restripe, and that'll be occurring in the next 6 months. I look forward to that. So we're reinvesting and trying to have the outside of the hospital begin to reflect the high quality we feel we've created on the inside of the hospital.
There we go. And changes also on the inside too, or
there will changes. My goal is I would like to see pink and teal reduced. However, I'm being told that the pink and teal colors are coming back in. I said, no, they're not. We're hoping
leave them up long enough and they'll come back.
Yeah, we want to remove the wallpaper, paint walls, create attractive setting, and improve the flooring. The flooring is clean, but it doesn't look new enough. So we have lots of remodels, patient bathrooms. One other major investment that we've made that'll be complete here, hopefully in July, is the clinic. There was a shelled space next to our primary care clinic there on East Main Street. We've leased that building, attaching the 2 buildings with a breezeway. We've built out that shell space. We're now in the sheetrocking that is nearly finished. We will, in the next 2 months, hope to wrap that up so we have a space for all these new doctors who are now very constrained by their current space. So that's $1.5 million investment to do that, to accommodate the growth that we have achieved with our physicians.
That's a good problem to have, though, needing more space for the physicians that you are adding, where, as you pointed out earlier, a lot of rural hospitals losing physicians.
And I love where we're at. You've never arrived. We know that we disappoint patients, never intentionally, and we're always looking for feedback. Anyone that ever has those concerns, reach out to the hospital, ask for Hoyt and administration, and we will hear you out and learn from what your experience was and try to avoid the next patient from having a repeat of that. We have fewer complaints than we've had in 4 years. The pace of complaints has declined, but we will always need to work on who we are and how we interact with patients and try to avoid every disappointment and be safe in every instance. That's our goal.
There we go. Well, I know I appreciate all your efforts, and so do many, many residents here in Payson and the Rim Country.
Thank you, and we appreciate our partnership with KRIM and being able to tell our story. Thank you.
Oh, you were so welcome, Hoyt. Thank you for coming in this morning. Thank you everyone for listening and watching this morning, and time to get back to the music here on KRIM with some Grand Funk Railroad, Rolling Stones, Rush, and more. But first, let's get an update from the National Weather Service. And again, hope you guys have a beautiful Wednesday.
This morning's KRIM weather forecast for Payson and
See you
surrounding
guys.
areas.